name is Alan Now. I am a board member of the International Society of Cannabis Pharmacists. This is a monthly state series that we host. If this is your first time joining us, thank you so much. It's going to be about an hour long. Rony, today we have with us Rony Sinharoy, cannabis pharmacist, worked in MedMen in New York City, as well as the botanist in Columbus, Ohio, and is currently working part-time at Pure Ohio Wellness. And in his spare time, he has his own consulting business, My Medicine LLC, which we'll hear a little bit about. Thank you so much for spending your time with us, Rony. For those of you that are kind of new to this, every month we go through a certain state. We interview cannabis pharmacists to see what they're doing in their specific state. See what kind of progress is being made. Every state has its own unique medical marijuana program, and with a lot of states going adult use soon, the landscape is rapidly changing. So Rony, take it away.
Sure. Thanks, Alan, for the intro, and thank you to the Society for allowing me to present on my home state of Ohio. I've lived here since I was 3, with a few instances where I stepped away for a couple years, but now I'm back. And a little bit about Ohio, just the geography and the political landscape. There's 3 largely Democratic pockets in Columbus, the capital, and Cincinnati and Cleveland. But then it's largely conservative everywhere else in the blue-collar rural areas. So the legislature is overwhelmingly Republican and purely a medical program. And it took a while until 2018 for it to enact. So that puts the political landscape a little bit into context of cannabis and what to expect in the future, and maybe why it took a medical program so long to develop. The neighboring states of Ohio are West Virginia, Pennsylvania, Michigan, and Indiana, and those often influence what goes on in your home state. So West Virginia is in the progress of developing a medical program. Pennsylvania's had one for a while now, and it's looking like adult use is around the corner. Michigan has gone adult use, and Indiana has no program to this date. So I think when Pennsylvania eventually falls, it might put some pressure on Ohio, and there are already murmurs in Ohio as well for transition to adult use. A little bit about myself. I went to Ohio State and then moved down to Florida to do a pharmacy program and a business program, and then came back to Columbus to work at CVS in retail. Did that for a while, and also did remote order entry for hospitals around the country at Cardinal Health. And then, like Alan said, I moved to DC, got interested in health policy, and learned about cannabis. And New York, they do require pharmacists to dispense medical marijuana. So spent some time there, and I loved it and saw what it could do. So when Ohio's program was starting up, I came back home because there was a dispensary group that was looking for pharmacists, and I'll get more into that later. And then I have transitioned to just part-time at a dispensary, and then work for a new company in terms of their pharmacy services, Hims and Hers. And that's my email below if you ever need to contact me. So we'll go through the certification process in Ohio, a little bit about the statistics, how pharmacists are involved, and then resources for staying up to date about not only Ohio's program, but cannabis in general. So the certification process in Ohio is a little unique. The price varies based upon not only the recommending physician and how much they charge, their physician group charges or the individual physician charges, but also the duration of the recommendation. And what I mean by that is in Ohio, a recommendation can be broken down into 90-day intervals. So depending on what the physician feels best or how much the patient is willing to pay, whether they just want to try it out, whatever they can afford, the recommendation can be 90 days, 180 days, 270 days, or the full year. So naturally, as you'd expect, the longer you get a recommendation for, the more expensive it becomes and the higher amount the physician charges. Typically, the physicians either charge for 1 year or 6 months. Very rarely do I see a 3-month one, and often never have I ever seen a 9-month one. But the price can range from $150 to $250 for a 1-year new patient, and then the renewals are slightly less because it's less labor intensive for the physician, and that ranges from about $100 to $200. I haven't really seen year-long renewals fall below 100 yet, but as more physicians' offices crop up, the competition may force that to occur. Once you've paid the physician for your recommendation, there's also a $50 activation fee for your card to the state. And then if you're just a caregiver, while you didn't pay the physician anything, to be a caregiver, you have to pay a $25 fee to the state as well. And there is no reciprocity at this moment. What Ohio said was, we will consider reciprocity if the state's program is very similar to ours. I think that's a little bit of talk that they just put that forward because there are state programs that are similar to Ohio's and they haven't really moved forward with it. It just doesn't seem like there's much will to do so where they want to engage in reciprocity. After the physician sees the patient, determines that the medical marijuana is right for them and they've verified the qualifying condition, they enter the patient's information into a state database that they have access to. And immediately after they do that, the patient receives an email from the state saying that they can activate their card. Pretty much right after you leave the doctor's office, you can have a visual emailed copy of your card within about 5 minutes, because you can just pay your $50 fee to the state right after the physician has uploaded your info. Then you get your image by email and you can head to the dispensary. At that point, there's a QR code on it that the dispensary can scan. So these are the 22 qualifying conditions. By far, the most utilized condition is chronic pain, as you might expect, and then followed closely by PTSD and fibromyalgia. While it looks like a lot of conditions, 22, the conditions will oftentimes overlap. So if you'll notice, Crohn's disease is on there, ulcerative colitis is on there, inflammatory bowel disease is on there. So that's basically 3 conditions into one that they've identified, and so that 22 isn't, in my mind, really 22. It really boils down to about 8 or 9 different ones that patients really come into dispensaries with. So in terms of the qualifying conditions, the medical board is who's responsible for approving the new qualifying conditions. We'll get into who kind of governs what in Ohio's program in a bit, but I think one factor that you'll see in terms of our patient count with respect to Ohio's population in general, one of the reasons why the patient count isn't quite as high as the industry and some of the constituency would like is because of the rejected conditions of depression, insomnia, and then anxiety. Those are 3 conditions that really increase patient count, which haven't been approved in Ohio. Every year, Ohio, the medical board, they look at petitions for new conditions. They give the industry and the general public 3 months to submit data about what conditions they would like added. This last cycle, depression, insomnia, opioid use disorder, anxiety, and autism were submitted to the board's requirements, and depression, insomnia, and opioid disorder were just straight out rejected for not enough evidence. Then anxiety and autism, I guess, made it to the next phase, but then they were also rejected against the medical advisory board. There's a medical marijuana advisory board. They chose to move forward with anxiety and autism, but then the medical board decided not to near the end of that process. So I'm assuming that this year these same conditions will be up. Hopefully there'll be a little bit more evidence that the medical board required submitted alongside with it, and we'll see if the program expands with respect to qualifying conditions after this cycle. In terms of what it takes to be a certifying physician to recommend, it's a 2-hour CE course. The state offers a few options that fulfill that requirement. The physician has to have an active DEA and ORS registration. ORS is just Ohio's prescription monitoring program. And then they have to show proof of CE that they completed on their application for becoming a certifying physician. Once they've done that, the process takes about a month. They get a certificate to recommend number, and it's attached to their medical license. And that link is a list of all the CTR physicians in Ohio, and they keep that updated pretty frequently. So there is a database. However, the contact information is sometimes hit or miss. So patients often do struggle to get a hold of the physicians, even though there is a database. Usually it's more of a Google search of, medical marijuana providers or something like that. Available products in Ohio, we do oil, tincture, capsule, and edible for oral administration, and then metered oil or solid for vaporization, and then transdermal patches, topicals, lotions, creams, ointments, just anything by topical. And then plant material is actually allowed in Ohio. There's one caveat, though. The enforcement has been little to none, but in the statutes, they said that if you're going to use any inhalable product, it must be vaporized and not combusted. So a patient can go to a dispensary, buy flower or plant material, but if they are caught smoking it or combusting it, then technically that falls within the program, outside of the program's guidelines, and they can lose their card and any other type of legal action that could take place. However, realistically, there isn't a good mechanism for that to enforce that. So when a patient buys plant material at the dispensary, what they do when they go home is pretty much out of the purview of law enforcement and staff members at the dispensary. So there are vaporization devices that are sold at the dispensary to vaporize plant material, but no paraphernalia can be sold that allows you to combust it. And a little side note here, everything must be dosable, which basically means the vendor or whoever the manufacturer is has to put on the label the amount of milligrams per dose. And when I say dose, I put it in quotes because the vendor actually decides what the dose is. And I'll just give you an example. Say you have, a cream that's 30 grams or a 50-gram container, and you say there's X amount of THC in that container. They have to say, okay, there's 50 grams, there's 10 doses in here or 20 doses. We are considering 5 grams a dose, or we're considering 2 grams a dose, and this is how much THC you're getting in that dose. So there's no consistency on what a dose is, but they do have to put it on a label to the best of their ability what they deem a dose is based on their product and how many milligrams of THC are in that dose. It gets a little bit tricky for inhalation. For instance, a vape pen, they'll say, hey, this is how many inhalations we think are in this vape pen, and each dose is about an 8-second or a 10-second draw, and this is how many milligrams we assume or try to predict that you'll get out of that inhalation of X amount of seconds. So, and that's all on the label and on the product. So they wanted to keep it very similar to pharmacy because the dispensary side of things are run by the Board of Pharmacy. So this is how your product allotment is measured in Ohio, and it's very convoluted and confusing. Basically, they said over a 90-day period, this is the amount of grams of THC or ounces of plant material that you're allowed to purchase in a 90-day period. And then what they do is they divide that amount by 90 to say this amount counts as a one-day allotment. And then once the patient makes a purchase, the dispensary puts in how many days worth they're getting. That gets submitted to the prescription monitoring program, and it keeps track of their allotment. And then the dispensary is also responsible for making sure a patient doesn't go over that allotment. So that's kind of confusing. So I'll give you an example. Let's take edibles. 9.9 grams of THC is considered a 90-day supply. You divide that by 90, and it ends up being about 110 milligrams of THC. So any edible product that's between 0 and 110 milligrams of THC total is counted as a one-day supply. Anything 220 would be counted as 2. 330 would be counted as 3 because they're saying 110 milligrams of THC in that package is considered a one-day supply. So what the vendors try to do is manufacture products that meet these benchmarks. So you'll get a pack of gummies that will have 20 gummies that are 11 milligrams a piece, which means 220 milligrams total. And so that package counts as a 2-day supply. When the patient buys it, the dispensary puts 2 in the POS system, and that gets transmitted to the state database. And what you'll notice is that each type of, or each form has a different amount of total THC over a 90-day period. So just because edibles in 110 milligrams counts as 1 day doesn't necessarily mean that translates into other product forms as well. So not only is the amount of milligrams important, but also the product form that's providing that dose also counts toward how many days, I guess, it takes up toward your allotment. Makes it very complicated to keep track of, particularly for staff members at the dispensary and for patients, because they're all constantly asking, how many days have I used and how much am I left to purchase? And you have to go in that state database and look it up for them. So a little bit about the program. Like I said, the legislation passed in 2018, but it took almost a year and a half for the first dispensary to open doors in 2019. Dispensaries must be about 500 feet from the listed public institutions there, and there is no healthcare professional required to dispense in Ohio. There are, a handful of states that do require pharmacists, but Ohio was not one of them. Even though it's governed by the Board of Pharmacy, the main lobbying group in Ohio for pharmacists wanted it, but the industry obviously pushed back because it increased costs of doing business. And at the end, they struck down the requirement of needing pharmacists to be in a dispensary. So there's 3 entities that govern Ohio's program: the Department of Commerce, the State Board of Pharmacy, and the Medical Board, and they all oversee different aspects. In some ways, it's good because you have a very identifiable, streamlined governing body responsible for different aspects. But in most cases, it's bad because the communication between the 3 groups isn't always the best. A lot of times, if something falls under one group's purview, it also influences how another department, how it's effective. So they kind of have to work together to put consistent guidance, and that's not always the case. So the main thing to take away, though, is that the State Board of Pharmacy runs the dispensaries and that the Department of Commerce runs the testing labs and the vendors. So those 2 groups really have to work together with respect to regulations and enforcement. This is just a little flow chart of the program as it stands in Ohio. One thing to note is that it's not vertically integrated, meaning that if you're a company that's won a license, in some states you have to control all aspects of the supply chain, growing it, processing it, and selling it at the dispensary. In Ohio, that's not the case. There's basically 4 different aspects that you could have applied for a license for. You can apply to run a testing lab, you can apply to be a cultivator, you can apply to be a processor, and you can apply to be a dispensary. They're all 3 separate application processes that are scored differently. That's not to say there isn't vertical integration, though, in Ohio, because if you applied for being a cultivator, it doesn't preclude you from applying to the other aspects of it. So there are companies, particularly the more well-financed ones, that are not only growers, they also process, and they also have their own dispensaries. So it's a large competitive advantage to the companies that won all 3 components of the supply chain, or at least even 2 of the components, versus companies that have maybe just won one aspect of it. So you can have any of the 3. You can have one of them. You can have any 2 of the 3, or you can have all 3 of the 3 if you're fortunate enough to win all those licenses. So a little bit about the statistics here. So far, there have been roughly 200,000 recommendations, 160,000 patients, and 140,000 different patients who have purchased medical marijuana. The discrepancy between the patients who have purchased medical marijuana versus the patients that are registered may be due to a number of factors. Maybe they got registered but decided marijuana wasn't for them. Maybe there weren't dispensaries close by. I know a lot of people that live in the northern part of Ohio just use their card to go to Michigan, even though they're not supposed to. So a decent amount of patients, even though they're enrolled in the program, have not actually used their cards in Ohio. And you'll see the very low number of patients with the terminal diagnosis. They made a distinction that if you're terminal, that you are allowed to purchase more medical marijuana than someone who wasn't terminal, but in reality, that hasn't really been utilized that much. So in the roughly 2 years that the program has been up, you can still see that not all of the licenses that have been awarded have actually become operational. The dispensaries have almost maxed out, same with the growers, but the processors are still up and being developed. Their litigation is one factor. Once you win these licenses, there's obviously a lot of lawsuits for the companies that don't win. And then financial reasons, whatever the reasons are, you can see that not all of the licensees are still up and running. The state did put out guidance saying, hey, if you win a license and you're not up and running in X amount of time, you can lose that license, but they have not enforced that. And the companies that haven't become operational, they can submit documentation to state why they're not yet, and the board looks that over, and they're usually pretty lenient on granting them more time. And then, as you'll see there's about 700 physicians that can recommend medical marijuana. So the role of the pharmacist, as I mentioned, the dispensaries are governed by the Board of Pharmacy, but pharmacists are not required to be on staff. They are incorporated voluntarily by some dispensaries, either in a full-time capacity, part-time, or as-needed basis. I put voluntarily in air quotes because some dispensaries do. They do see the benefit that the benefit in terms of helping that patients from a clinical standpoint. They see the benefit from a regulatory and operational standpoint because the dispensaries are governed by the Board of Pharmacy. A lot of the rules and regulations are very similar to a traditional pharmacy, so pharmacists can be an asset there. But very few dispensaries are really doing it full time. The ones that are, and like I said, I put volunteer in air quotes, is because on these dispensary applications, the companies that applied for these licenses, they saw that the Board of Pharmacy is governing the dispensaries. So by putting on their dispensary application that we are going to have pharmacists on staff, from a scoring perspective, it looks better to the Board of Pharmacy, and they give those companies more points if they say that they're going to have a pharmacist on staff for the sake of patient safety and operational reasons. And so what a company put on their application has to be adhered to for a certain amount of time. I believe it's a year. So these companies say, hey, we want a pharmacist on staff. They win their license. I wouldn't say in large part due to that, but at least in some respect due to that. And because they put it on their application, now they are bound by that application to employ the pharmacist for at least a year. I think what you'll notice though is once they do that, provided that they can afford that pharmacist financially, they do see the benefit of it, not only from a patient care standpoint, but by how well their dispensary operates from a regulatory standpoint as well. And then other dispensaries who maybe didn't put on their application see that and would like to have pharmacists as well because they've heard how it can be beneficial. And that's when they typically are staffed in a part-time or a PRN basis to just help maybe counsel patients and make sure things are running smoothly from an operational standpoint. So that's just a brief summary of Ohio. There's a lot of nuances to it that I could definitely expand on, but for the sake of time, I'm not going to. Here are some resources. There's a link to Ohio's program at the top, and then some resources that I have found really helpful. The second one is a database for medical marijuana and research in the sense of you can just type in a condition or just type in a research topic and it pulls any clinical studies that have been published. You can find that through Americans for Safe Access too. That's another website I really use and does a good job of summarizing and a one-stop shop, you can say, for all different conditions. And there's a link to that database through Americans for Safe Access as well. And then this book recently came out. It says it's copyrighted in 2021. It's one of my favorite resources recently because it's up to date and they do a good job of talking about the clinical aspects of medical marijuana. So I'll now take any questions that you guys might have and just appreciate you guys letting me talk about Ohio.
All right. Thank you so much, Rony. That was very informative. It's always interesting to get a glimpse into every state's medical marijuana program and especially the intricacies of how they differ per state. So I guess we'll start at the top. There are some questions that are in the chat right now, but can you kind of go through the role of the Board of Pharmacy and where you see a lot of similarities between pharmacy regulations and medical cannabis dispensaries?
Yeah, sure. The Board of Pharmacy put out labeling guidance. I think that might be one of the biggest ones where they have specific requirements for what goes on a patient label, the doctor's name, the name of the product, the dose, the patient's name, pretty much what you'd expect to see on a pharmacy label. It's very similar on the medical marijuana products label as well. So labeling is definitely one aspect of it. Record keeping, it's almost identical for how long you need to keep records for pharmacy records as opposed and compared to dispensary records as well. Signing off on who picks up your medical marijuana, that positive identification, for instance, what you see at a regular pharmacy in terms of signing who gets the prescription or somehow documenting that, as well as who gets medical marijuana. There's some parallels there as well. So that kind of thing, those are the three big things that kind of stick out in my mind: labeling and record keeping. And inventory controls, how often you have to conduct your inventories. That's very similar, or just the fact that you have to do that is very similar to traditional pharmacy as well. And so those are some examples that, really stick out in my mind. I'm sure I could think of more if I had more time.
Yeah, great. So from a regulatory standpoint, we're kind of used to all these measures. We have to cross all our T's and dot all our I's all the time. So yes, that's something that I found that translates very well too from the pharmacy world. Now, can you go to the slide about dosing? That's really interesting because as much as everyone is trying to standardize what a cannabis dose is, whether it be for THC or CBD, it seems that every state has its own kind of unique formulations, unique dosages, same dosage forms for the most part. But how do you navigate what is considered a dose for your patients, given the products that are available?
Are you talking about more from a patient counseling standpoint in terms of dispensary staff, or are you talking about more from the manufacturer standpoint on how they determine what's a dose?
From the patient side, because from a standard dosing perspective, 2.5 milligrams of THC is kind of like the universal starting point. But when you have something with 111 milligrams of THC, how do you work around that?
Well, there's two things there. When I say 110 milligrams of THC, that is the entire package. So that's not one unit. So for instance, if it's 110 milligrams of THC is considered a one-day supply. If you have 10 gummies and they're 11 milligrams each, and that whole thing comes into a 110 milligram container, that 110 milligram container is still broken down into individual units, which can be dosed a little bit more safely and accurately. But from a patient standpoint, one similarity between pharmacy and the medical marijuana program here is continuing education requirements, and staff training requirements is another regulatory aspect that you have to follow. So in terms of talking to the patient and talking to them about a dose, the dispensary staff does have to go through some training, and that training actually has to be signed off when it has anything to do with medical administration of the product. Has to be signed off by a pharmacist or a doctor for that dispensary to have approved training. So typically in that training, they do go over dosing a little bit, and the dispensary staff members are pretty well versed in knowing this is a safe dose for a patient that's just starting. This is a common dose for someone that it has a little bit more cannabis experience. But when you start to get into the finer nuances of this is a specific medical condition, or this is a specific dose, or sorry, this is a specific symptom, how much THC or how much CBD can I use? There really isn't much oversight to that. It's mostly just trial and error, but they do have a sense of, this is a good starting point, but in terms of what ratios of THC and CBD to use, there really isn't much guidance on that. You're pretty much left to what that particular staff member at the dispensary kind of decides to tell the patient based upon their own experience and what level of knowledge that they have. But for the most part, I think across all dispensaries, that at least that basic foundation of what's a reasonable starting dose for a patient that hasn't used cannabis, and what's a reasonable method of administration based upon what the user is trying to achieve. They do a pretty good job at that. It's just when you start to get more nuance, that's where it can really deviate from staff member to staff member.
Yeah, and that's exactly what I found too, working in the medical cannabis dispensary, that it's kind of strange coming from the pharmacist perspective, where we're given a prescription written by a doctor and we have to fill it exactly as is, but with more autonomy with the patients. This is also has to do with the general kind of safety of cannabis itself with consumption. But we do have, it's kind of liberating almost to have full autonomy over what to recommend for a patient without having to worry about such serious side effects.
Yeah, I mean, the safety profile of cannabis does allow this modality. I mean, it's not the best. Obviously, we wish it could be more refined and based upon a little bit more science, but you're right. I mean, in traditional medicine, the doctor kind of tells you what to take and exactly how to take it, and then you go to the pharmacy and it's largely transactional. Here, it's pretty much completely the opposite. You go to the doctor to get your card, which is largely transactional, and then when you come to the dispensary, that's when you get the guidance on how to use what product, how often, and at what dose. The only difference is the people that are providing that information don't always have a medical background or make those recommendations based upon, reliable sources.
Right. Okay, so we'll go to some of the participant questions. I have a question from Maisha. How do you win a license or apply for them, specifically in Ohio?
So depending on when the state opens up more licenses, and actually I believe they're about to now because the dispensaries are getting pretty overrun with patients, the Board of Pharmacy will, or whoever governs whatever aspect. So for dispensaries, the Board of Pharmacy, for growers and processors, the Department of Commerce, they'll say, okay, we are now going to open up we're going to open up an application cycle. So from this date to this date, here's the application guidelines, just like you would apply almost like for a college, and say, this is the requirements. It's a pretty lengthy application, to be honest. And they want to make sure you have cannabis expertise, you're well-financed. A lot of different factors go into winning these applications. So then, groups apply for them, and in that window, and as long as you've submitted your application before the deadline and paid all the fees, then they start the process of scoring them, and each group has a group of people that score the applications, and depending on how many licenses they want to award, they score those. And the way Ohio did it is each county, based on their population, got a certain amount of dispensaries. So even though there's 57 in the state, Columbus, which is the largest city in Cleveland, those two have 5 each, and that's the most. I mean, there's no city that got more than 5, because they said, according to the population, we think 5 dispensaries is enough. However, if you go to the rural areas where it isn't very populated, they'll say in this area, if you apply for a dispensary, we're only going to allow 1. So not only is it the total amount of license that they're going to award, but also where you want that dispensary to be influences how many licenses that they're going to award as well. So yeah, it's an application process. They open it up. They have all the application guidelines online. You go through them and you apply. And then, like I said, if you're lucky enough to be in the top whatever X amount of dispensaries or growers or processors that they're going to allow, then you win that license. After you win it, you've essentially won a provisional license. That just means you have the capability now to move forward. You won a provisional license, and then that's when that clock starts ticking about becoming operational, and then meeting all the guidelines and passing your inspection to meet those requirements as well.
Right. And a question from Sandra. Do you think a master's degree in medical cannabis is necessary to get a job? University of Maryland has a degree program now.
I think it depends on in what capacity. Right now, probably not. just because that program's so new. I think most people don't even know about it. But I think down the road, as cannabis research starts to expand, as more drug companies maybe get involved, as more nuances start to become discovered with medical marijuana or just marijuana in general, if you're looking for a competitive edge and you really want to get into maybe research and development with cannabis, maybe on the processing side where you're extracting cannabis and you're creating different formulations and deciding, what kind of cannabinoids go in what product, and the best way to really utilize all the different constituents of cannabis medically, then I think that master's program will become much more important, I guess, in the application or the hiring process. But right now, as it stands, I don't really see, particularly in Ohio's industry, people really looking for that kind of expertise as a requirement to be hired. Now, if you're an applicant and you have that on your background and you're going against someone that doesn't, naturally you'll have a leg up. But in terms of that degree getting you a very high level position within a company, I think that by itself probably isn't necessary or would do the trick just yet. But I think if you're looking down the road, who knows, 2, 3, 4, 5 years down the road, and this industry grows and everyone kind of has similar backgrounds and experiences, anything that you can do to differentiate yourself would be helpful. But I think it also depends on what area of the industry you want to go into. And with the master's in that program, it would probably be more into the research side of things, and not necessarily maybe the industry side of it, like working at a dispensary or something.
I agree with that sentiment. The dispensary technician / bud tender position in most states that I've seen is a very entry level job. For my own dispensary, I had college grads, I had high school grads with no degree, and a mixture of everything in between. So to do the actual job of running a register, it doesn't, it's a very entry level position. But as the industry matures, as opportunities become available, that master's program is going to, I think at least, be a great defining factor if you want to make a career in cannabis. And,
Right.
even though
I do know, I do know a few processors in Ohio that do say we want you to at least have a bachelor's in chemistry or something if you're going to come work with our extraction, equipment and things like that. From a processing side, that would probably be where it could be relevant right away. But I think that program, or maybe for a drug company that's researching cannabis for its medical properties. But other than that, in terms of the industry side of things, I don't really think it's on people's radars just quite yet.
Yeah. And I think I know the answer to this question already, but what was the extent of learning about cannabis in school for you?
In pharmacy school, 0. Yeah. So I'm a little older though. I guest lectured at Ohio State. So Ohio State now, it's 5-10 miles from me. They do now in their therapeutics for their third year pharmacy students have a day where they do a lecture on cannabis medicine. So that was good to see. I know there are pharmacy schools around the country that are starting to engage in rotations for their students. And even in Ohio, we're still trying to put that program together. I tried pretty hard with Ohio State, but they're a really large institution that's federally funded. So I think they're still dragging their toes on getting involved with actually sending their students to the dispensary. The interesting thing is the Board of Pharmacy, though, put out a guidance saying, if there is a school interested, we're going to allow the dispensaries to have pharmacy students in the dispensary. They still have to go through the whole badging process and everything. But the fact that they even acknowledge that this is something dispensaries are able to do, to have pharmacy students at their dispensary, is a sign that maybe things are changing. But if you don't have pharmacists at those dispensaries to run the rotation for those students, it doesn't do you much good. So, but I guess the short answer to your question is I had 0, but at least there is at least one day in a therapeutics class that they are spending on cannabis at Ohio State. So.
Yeah, share a very similar sentiment as well with my alma mater. Rutgers University, but it is coming. Yeah, you're absolutely right. I was able to lecture for Rutgers University also. It was a community practice elective, but at least it's a conversation that's going to get going. So something to look forward to down the line. So we did have another question from Maisha about starting your own business. Do you want to talk about your consulting business, My Medicine LLC?
Sure. I mean, the point for me starting it was when you go to the dispensary, you don't have that much time with the patient. I mean, if you're running a dispensary, you have a lot of things on your plate, and if you're talking to a cannabis user for the first time, that counseling session can take a good amount of time, 30 minutes to an hour. So think of it as in retail pharmacy. You don't think if you had to spend 30 minutes to an hour for a patient for each time they're getting a new drug, that's just not feasible. And then the patients that really do want guidance for a pharmacist, they are probably dealing with high level conditions, a lot of symptoms, never been using the product before. So there are a lot of clinical considerations and things to take into account. And in a dispensary setting, when you're doing a bunch of other things, that really isn't feasible to do and do it in a good way. So what I decided was just to start a consulting service where if patients or physicians want their patient to get a little extra guidance from someone that has not only the cannabis background and that understands the industry, but also a clinical background, they can sit down with that patient and understand what's available at the dispensary and understand how to use these products tailored to the patient and their condition and symptoms, and do it in a way that's comfortable for the patient where they don't feel rushed in a dispensary setting. Also, the point of it was, like I said, in Ohio, not all dispensaries have pharmacists. So if you go to a dispensary and there's no one there with a clinical background, they don't really have any mechanism to get that information. So that's why I incorporated the telehealth aspect of it. So regardless of what dispensary you go to in Ohio, if you want that guidance, you can schedule an appointment and still get it, because the products, whether you go to a dispensary in a southern part of the state or a northern part of the state, they're generally the same because the vendors are working, within the state, and those are the same vendors regardless. And makes it easy to look at a menu no matter where the patient is and start to select products and develop a treatment plan for them. I think that's one aspect of it. A second aspect of it is, and what's in development, is kind of merging the clinical side of things with the industry side of things, in the sense of pharmacists and physicians, they may know a lot about the clinical side of cannabis, how it can help with certain conditions, how THC and CBD can interact with the body and the different ratios and dosages, but they don't really understand the nuances of the different products that are available. So even if a doctor goes through that continuing education, they'll go through look at a dispensary menu and be completely lost. So that information that they have, they can't apply it because they don't know the products or the industry very well. And then on the flip side, you have the people at the dispensary that do know the products very well, do understand the industry, the nuances of the different products, but then they don't have the clinical knowledge oftentimes to use that information for that subset of patients. So basically being that bridge between the two, where you have the product and the information from the vendors and the manufacturers about how to use those products and dosing, and then the clinical aspects of, what actual dosing and what that patient needs from a symptomatic and the specific condition that you're treating.
Great, thanks for that summary. That's a great business model. One hot topic that I do hear from either pharmacists or physicians alike is the question of liability insurance. When you are working at a dispensary, you hold a valid pharmacist license. However, are there any additional measures that you would recommend taking for pharmacists to protect themselves?
That's a tricky one. So it kind of depends on the program itself, and the dispensary you work for provides you with a little bit of protection, in the sense of when you go to a dispensary, there's usually some sort of waiver that you sign that says you're aware of the risks you're aware that this is not FDA approved, all that stuff. And then being a badged employee of the dispensary, that you've gone through the training that the state requires, affords you some protection as well. That as a dispensary employee, you're being protected by the dispensary and the state saying you're allowed to give some guidance to a patient. But I think as a pharmacist, naturally, you're going to get questions that are more clinical in nature that maybe a regular dispensary staff member might not. And then you start entering into the practice of pharmacy. The state, in Ohio at least, they did put out a guidance saying pharmacists are allowed to practice, pharmacy in a dispensary, so that if a patient asks a drug-related question, they can give that response. But typically, when you work for a CVS, a Walgreens, a hospital, they have that protection kind of within the company for your license, so you don't need additional. Most dispensaries, actually, I can't think of any dispensary that will go and get, liability insurance for their pharmacists or for their practitioners. So I would say that if you are going to counsel patients on, if you're going to practice pharmacy and counsel patients on medication while you're working in a dispensary, I would get additional supplemental insurance. I've always had it anyway, regardless of what practice setting I'm working on. So it wasn't a thing I thought about. But when I started the consulting service, that's definitely something the attorney made sure, because now I'm not under any umbrella. I'm just kind of on my own, providing, practicing pharmacy within the purview of cannabis. And so they made sure, you've got all your waivers and your consent forms and everything straightened out, as well as protected yourself too.
Great. Thank you for that insight into that information. There's a question from Robert. I guess new blending technology has pharmaceutical CBD terpene blend. What would be the best channel for, I guess, a CBD processor to get into Ohio dispensaries?
So in Ohio, if you're actually a CBD processor, you can't, and you're extracting CBD from hemp, which you're required to, you can't be in an Ohio dispensary. The reason being, Ohio dispensaries don't allow non-medical marijuana products, so in their dispensaries. So you're not able to sell just regular hemp-based CBD in an Ohio dispensary. So the short answer is you can't, because it's not a product that's coming from an approved entity in the state of Ohio, like the entities that have won those licenses. They're strictly making marijuana-based products at the dispensary, or selling the marijuana-based products at the dispensary.
Cool.
Did that answer that question? I'm not sure. I just want to make sure it did.
There's one last question from Aisha again about getting your contact info. So we do have 5 minutes left. So if anyone has any other questions they want to ask, now is the best time. But if you could put that screen up with your contact info, Ronnie, that'd be great. If anyone has any follow-up questions.
Let me get to it with my email. Sorry. There we go. Wait, that's not it. Sorry. That's it. Okay. That email at the bottom.
Perfect. So Ronnie at mymedicinellc.com. All right, Ronnie, thank you so much for your time again. Really, again, appreciate you volunteering your time to tell us about your job and what you do in Ohio. Do you have any kind of follow-up statements, any kind of closing statements that you want to make?
No, I just think there's such a small amount of us. There's only a few pharmacists and pharmacy students that are really actively pursuing and engaging in this industry, that we can do, I think, some pretty cool things if we just stay in contact with each other and share different ideas and work together. Because, like I said, it's only going to expand from here, and unless we kind of dig our feet in and try to create a spot for medical professionals to be involved in this industry, it's just going to move forward without us. So I think the more we can prove our value, get involved, show that what we have to offer, it might be a little optimistic, but like I said, if we can do that, and it's easier to do that as a group, which makes this society so good, the industry has to kind of incorporate us or take note of us, because otherwise, if not, and we don't actually put the effort to do so, it's just going to go in a direction where the clinical side of cannabis just isn't pursued the way that we're used to, like in traditional medicine.
Yeah, and that's definitely a resounding kind of tone that I've seen from pharmacists across the U.S. that everything is new, everything is brand new. This industry has not been established to any full capacity, whether it be in the state or federally. So we, as International Society of Cannabis Pharmacists, do have an opportunity to kind of write that path to create and unify pharmacists that are going to make an impact. As more research comes out, as more states come on board, and as federal legislation changes, we're going to be kind of on the forefront pushing the medical cannabis side of it. All right. So thank you so much, Rony. We do appreciate it. And I hope everyone has a great rest of the evening.
Yep, you guys too. Thanks.